Welcome back to Wake Up with Cheddar. The U.S. has surpassed 20 million COVID cases since the pandemic began. December was the deadliest month yet for the virus in the U.S., and experts warn that January will likely be worse. So what lies ahead for us? Joining us now is Dr. Nasia Safdar, medical director at UW Health in Madison. Doctor, great to have you on. As I just said, December, the deadliest, most infectious month for the U.S. when it comes to this virus. But a lot of experts say January will probably be worse. What should we be expecting?
I think just as we've seen with other holidays, there typically is a bump and a surge in cases that happens because people have gotten together over the holidays. And so I think that with Christmas having just occurred and the New Year, I think it's likely to think that there will be a bump in the number of cases more so than what we're already seeing.
When do you think that might start to level off?
I think it's hard to say. What we've seen is that the pandemic and the virus is a very regional type of situation. So it is rolling from state to state. There are certain states that are really struggling with the number of cases and the hospitalizations, and others that recently had this experience and it's leveled off a little bit. It isn't really good anywhere in the country, I think, but it's particularly bad in some areas.
One area is California, for example, where hospitals are just stretched really, really thin. Do you think that we're going to see what's going on in California? Do you think that we're going to see that in other states?
I think it's highly likely. I think if you look at the previous trajectory of it, is the typical situation seems to be you have a large number of cases, eventually they diffuse into the population that is vulnerable and the people that need medical care, which then leads to a greater number of hospitalizations. And then unfortunately, a number of those people end up not being able to recover from it. So if the past is any predictor of the future, I think it's likely that we will see something like this occurring again.
It's all coming, of course, as there are finally 2 vaccines approved for emergency use here in the United States. Really, we're falling short so far. Only about 4 million doses have been administered. The goal was for 20 million by the end of 2020. What do you think is going on? Why do you think we're falling so far behind here?
Well, I think partly it's because strategies are having to be devised by states based on their resources. And those resources, I think, there's a lot of variation in those resources. You need to be able to have a pretty excellent logistical infrastructure to be able to deliver such large quantities of vaccinations to large numbers of people. And not every state and every place has the ability to do that. I do think that the expectation was there would be a lot more people vaccinated. I mean, this is the one thing that could change the way the pandemic is behaving in the US. So the sooner we are able to do that to large swaths of the population, the better it will be.
Is there anywhere right now that you think is doing a good job? I know this has been kind of different depending on where you live, not even just state by state, county by county. Any area so far that you think is doing well?
Well, I think in general, if you think about the high priority population, so for instance, healthcare workers, I think health systems have done a good job of delivering it to the frontline healthcare workers, one of the most vulnerable groups for this pandemic. I think the next step is to really deliver it to the people who have comorbid conditions, who are less likely to be able to recover from COVID should they get it. And I think that process could definitely be expedited to be able to do that in a much more efficient manner than has currently been happening.
The head of Operation Warp Speed said over the weekend that they want to consider this new option for speeding up vaccinations, which would be to give 2 half doses of the Moderna vaccine to people 18 to 45. Can you explain that a little bit? What would that mean? Would it be as effective?
Well, I think that's really what we have to determine, and that can only be determined by the advisory panel that's looking at the data and seeing if the effectiveness of the vaccine is similar from the 2 doses, the half dose and the full dose, then I think it's a reasonable strategy to take. But it has to be really examined in the context of the data and what it showed. If it wasn't as effective as one would like it to be, then I think that's a strategy that shouldn't be employed. But without having seen the data in a rigorous manner, it's a little bit hard for someone to say.
And then there's this new variant or this new mutation that we saw in the UK. It is now here in the United States, in Colorado, California. How worried are you about this? What does the public need to know?
I think what the public needs to know is that viruses mutate all the time. And this is not the first time that this particular virus has mutated, nor is it likely to be the last. But there are certain mutations that are more consequential than others. And this particular one, I think, is a little bit more consequential because it seems to lend a higher transmissibility potential to the virus, making it easier to transmit from person to person. So the same behaviors that limit the spread of SARS-CoV-2, such as not interacting with people outside the household, staying 6 feet away and so on, are also behaviors that will help prevent this. But we do have to remain vigilant. Of course, it is possible that other mutations will result in this virus that may be even more consequential than this. But so far, I think the fortunate thing about this mutation is that it doesn't seem to lead to more hospitalizations or more deaths, and it is expected that the vaccine will still remain effective against it. So I think those are potentially two silver linings from this.
When we talk about it being potentially more contagious, one of the things that I was just thinking about myself is that, we sort of, as we learned more about the original virus, realized that it was primarily airborne and we're, I think, less focused on touching things like wiping down packages and grocery bags and things like that. Do you think that that's something that might change? Do you think we need to be even more vigilant? Or if we're following the guidelines as they are, do you think that that's enough to protect people from this new variant?
I think we just have to remember that the virus travels with people. It can certainly contaminate the environment, but it isn't a virus that will stay in the environment for days and days. So we certainly need to clean high-touch surfaces like we would for any respiratory virus. But the main mechanism that it's going to spread is if you encounter somebody else and they're vulnerable to getting it, then transmission is likely. So wearing masks, both parties, if they are interacting, both of them wearing masks and then staying far apart from each other is likely effective. It's been hard to do. And I think this many months into the pandemic, it has been challenging to sustain, but we can't lose sight of the fact that it does work when it's applied effectively.
All right, Dr. Nasia Safdar, Medical Director at UW Health in Madison. Great to have you on this morning. Really appreciate it.